Mr. Subramaniam, nice to see you again.
Nice to see you as well.
So, we're here to talk about lower urinary tract symptoms. You guys call it LUTS, okay? But all that matters here is my symptoms, Sobs. And as I'm approaching 6th decade, I know at least 50% of male patients are going to have these symptoms. And females too, but I can only talk about my stuff for the moment. Now, you can tell us about the female, but I'm beginning to get up at night, okay? I'm beginning to have difficulty in getting my stream going. Sometimes I have a compelling desire to pee. I kind of lost my confidence a bit. There's sometimes overflow and dribbling when I don't want it. So, and you know, I've talked to my older friends. Some of them, like 20 years older than me, they have to wear diapers. They sometimes wear pads. They have dark clothing. Everywhere they go, they have to look for the toilet, just to make sure they know exactly where to go. Is this something you recognize?
Of course, this is what we deal with day in, day out. As you get older, your bladder gets a bit weaker. Naturally, the whole body gets weaker, and bladder is part of that. And there is a gland called prostate, which sits around the neck of the bladder,
only in males.
Only in males. Around the urethra or the water pipe that comes out of the bladder, taking urine down, and the prostate gland enlarges as you cross the age of 50. It starts enlarging. Normally, it's a walnut shape. It was about 20 grams, and as you get older, it can get bigger and bigger.
So I guess it's fine if it enlarges outwards, but the problem is the tube goes outside, that comes out of the bladder goes through it, right?
Yes.
And if it enlarges inwards, it's going to press on that tube.
Absolutely, and that means apart from a weak bladder, you've got a second problem, which is prostate pressing on your water pipe, which makes you go more frequently, or sometimes you have trouble in passing urine, so you have to stand there a bit longer, especially if you're standing in a male urinal. There are people come and go, and you're there a bit longer, and you start realizing that you're having to wait there for longer to empty your bladder.
I can sing a whole song.
Yes. Yeah. Yes, and also night time it irritates your bladder, so you get up at night to pass urine as well. So these are common things that you experience with these problems.
So you said two things. You said two organs: bladder, prostate.
That's absolutely right.
Yeah. My whole understanding of the bladder, the whole point, and really I think the only point of the bladder is that it holds and empties urine. And you're telling me as we get older, it even gets bad at holding and emptying urine.
Yes. Now, that can be due to two reasons. So I mentioned about the bladder getting weaker. It depends on the strength of the bladder. So some people are born with weak bladders, so they've always gone more frequently than others, and they tend to get problems slightly earlier. And also, it depends on what you drink. For example, if you're drinking 6 cups of tea, tea is a stimulant of your bladder, so you will go more frequently than someone who's just drinking water. So someone might have drunk tea all their life but not had a trouble with the waterworks, but as they cross the 50, when the bladder gets weaker, even the same amount of 6 cups of tea can make them go more often. So first and foremost, when you get bladder symptoms, it is important to look at what you drink. And if you drink a lot of tea and coffee and even alcohol, these can make you go more frequently and even get up at night.
Let me add the physician bit here as well. You touched on it, the history, Because you're a surgeon, I'm a physician, I always think about physician-y things. I'll be wondering, diabetes. I see patients with congestive cardiac failure, they can have these kind of symptoms.
Yes.
I'll go through their drugs as well. Some drugs, right, diuretics, for instance, obvious one, will give you these kind of symptoms.
That's right. Agree? Yeah. If someone is on diuretics, that will make them go more frequently as well. And diabetes is a well-known condition where you produce more urine, so you have to go more frequently. In addition, the diabetes can affect the nerves of the bladder, and therefore making them what we call as overactive.
So what's going to happen in real life, Sobs, is I'm going to cope. This is what I'm going to do. There are other people might do it differently, but I will cope until I can't cope anymore. Then I'll come to you. So you will get a history of me. Are there any other danger things you'll be asking me about?
Yeah. So first and foremost, if you've done your lifestyle measures, controlled your fluid intake, and if you're still bothered,
Yeah.
obviously you will come to me or go and see your GP, and you will be examined to see if you have a full bladder,
Okay.
if you are emptying your bladder completely.
So sometimes you can palpate
Yeah,
that.
you can palpate the bladder or
Yeah.
do a scan of your bladder. You'll be given a rectal examination where you can feel the prostate gland.
So size and how it feels as well, is that right?
That is right. So
Yeah.
sometimes you can have a hard prostate, which can indicate that there may be something else more sinister going on in the prostate. And after this examination, if you're found to have a large prostate and your bladder is not emptying completely, we may also do a flow test where you would be asked to pass water into a machine which measures the strength of your flow.
Oh wow, okay.
So if you have a big prostate which is causing restriction in the flow,
Okay.
that will show up on the flow test.
Okay.
And this combination, your symptoms, a large prostate, a poor flow or strength of flow, will suggest that you have prostate enlargement, and therefore will suggest some treatment for that. Should we stop and see how we go?